my name's Sian Thomas Cutts and I'm a cancer support worker here at Dorset County Hospital. I work with the haematology and lung cancer teams. We've brought you here today to go through our cancer information and support session. This is something that we were doing prior to COVID. In those days, we were able to run a face-to-face session for patients such as you who have just received a diagnosis of cancer. We encouraged you to come along with a partner, friend or family member to our 2-hour group session so that we could provide you with a wealth of information and support as you move forward through your treatment.
Hi, my name's Vicky Hyde. I work with the Macmillan Therapy team here at Dorset County Hospital.
Hello, my name is Sally Phillips and I'm Macmillan Cancer Support Worker. I work with the colorectal and urology teams here at Dorset County Hospital.
Hello, my name is Stephanie. I work as cancer support in the upper GI, which is upper gastrointestinal, and the head and neck cancer teams.
What is cancer? Cancer starts in our cells. Cells are tiny building blocks that make up the organs and tissues of our body. Each cell has a control centre called a nucleus. The nucleus receives signals from the body to say when the cells should divide and grow, and when they should stop. These molecules can work inside the cells or on their surface. The nucleus then tells the cell what to do. Usually cells divide in a controlled way to make new cells. When a cell is no longer needed or can't be repaired, it gets a signal to stop working and die. Sometimes the signals go wrong and the cell becomes abnormal. The cells keep dividing and making more and more abnormal cells. These cells form a lump called a tumour. Not all lumps are cancer. Doctors can take a small sample of cells from the lump. This is called a biopsy. They will look at the cells under a microscope. This will allow them to examine the cells and decide if the lump is cancer or not. We're getting better at recognizing and treating cancer, so today many people with cancer can be cured. Even if a cancer can't be cured, it can often be controlled with treatment for months or years. Your doctor or nurse will talk to you about this. For further information or support, call us free on 0808 808 0000 or visit macmillan.org.uk.
I would like to talk to you about the professionals who will be involved with your care. Your main point of contact will be your clinical nurse specialist, who is often referred to as your CNS. Your CNS works from Monday to Friday, usually from 9 a.m. to 5 p.m. You will be given their contact details, and it's important to remember that if your team try to contact you, this will show as a withheld number, so please bear this in mind. There is a huge team of other professionals involved in your care. You may not get to meet them, but their input is invaluable. These include radiographers, doctors, your GP, oncologists, pathologists, your CNS, occupational therapy, physio, speech and language therapy, and nurses. It's important to remember that you are also part of this team. There may well be others, as this list is not exhaustive. All patients with a suspected cancer are discussed at a weekly multidisciplinary team meeting. These are attended by all the professionals involved in your care, and together they put forward an individualised treatment plan proposal for you. It can take up to 3 weeks for test results to be returned to us, as some of them will be analysed at other hospitals. We are aware that you may be very anxious during this time, but it is important to wait for all results before deciding on the final course of treatment for you.
I'd like to talk a little bit about what to expect whilst you're going through your treatment. There are various stages along the way, and these will vary from person to person. It's very important to bear in mind that your diagnosis is particular to you, and so too is your treatment plan. It's subject to change as you progress through it, we may find that something will work better than what we initially proposed, or that you're not responding in quite the way we anticipated originally. So throughout your treatment, there will be regular reviews and we'll look at all the options as we go along. An important point to mention here, you'll see that we're mentioning palliative care. A misconception is that palliative care means you are at end of life. That does have its place in palliative care, but for the most part at this stage, palliative care is more about addressing symptoms so that we can move on with your treatment. First and foremost, we want to remove or cure the cancer if this is possible. Other options are to slow down or stabilise the growth of the cancer, relieve symptoms. This one's really important and we need you to keep talking to us about your symptoms. Sometimes we'll do one treatment first to make another treatment possible or more effective. Obviously, we do strive to reduce the risk of cancer coming back, and throughout all of this we need to monitor the cancer. It is possible that you might be able to participate in clinical trials. We don't actually operate many of these here at the hospital, but if you think that you might be interested in participating, do speak to your team and see if they know of any appropriate ones. We have to mention as well that the option of no treatment is also a treatment option. It's our job to put forward a list of treatment proposals, but if you choose not to have treatment at all, that is entirely down to you. If you want to go that route, we will still support you. Don't think for one moment that we will stand back and not give you any support. And again, just to reiterate, it's really important to remember that your treatment plan is specific to you. If you come across somebody else with a similar diagnosis, their treatment may be different to yours. When people hear about a cancer diagnosis, the first treatment that springs to mind is chemotherapy. Indeed, this tends to be the most popular option still, but it's important to bear in mind that it has come a long way over the last 20 years or so. For the most part, chemotherapy is administered here in our day unit, Fortuneswell Day Unit. When you have chemotherapy, it's normally done by inserting a needle, a cannula, into a vein in your arm, and it's administered what we call intravenously, IV. You'll find you're hooked up to a drip and you'll be given a comfortable seat in the chemotherapy unit. You may well be there for the best part of the day. You'll be monitored very carefully throughout the treatment to make sure that you don't have any reactions, and there will always be nurses on hand if you have any concerns or questions. Immunotherapy is quite similar to chemotherapy, and it's more of the newcomer, and you're going to see advances in immunotherapy over the next few years. It's often administered in the same way as chemotherapy, so via an IV drip in your arm, and again it can take several hours to have your treatment. Broadly speaking, the difference between chemotherapy and immunotherapy is that chemotherapy seeks to destroy all the cells in the body, including the cancer cells, and then when the body rebuilds itself, hopefully it will be without the cancer cells. Immunotherapy, on the other hand, puts your body's immune system into overdrive so that your body is actually attacking the cancer cells. For both immunotherapy and chemotherapy, sometimes they're administered in tablet form or possibly even injection form, and that means that you don't need to stay in hospital all day or for several hours at a time. Radiotherapy is another option. You may well be aware that we now have our own radiotherapy unit here at DCH. Unfortunately, not everyone can have their treatment there at the moment, but the list of people that we're able to treat is growing all the time. Broadly speaking, for radiotherapy, there are two different types. There's palliative radiotherapy, and then there's a course of radiotherapy. Palliative radiotherapy is administered normally just as a one-off, and it's to help with pain relief. If you're having a course of radiotherapy, that will probably be done at our pool unit. You may well find that you need to attend every day, Monday to Friday, for up to 6 weeks. So although the treatment itself only lasts for about 10 minutes at a time, there is that daily commitment to attend. Surgery is also used, and sometimes that may be in conjunction with the other treatments I've mentioned. It could well be that surgery is used to remove your tumour, but that may happen after chemotherapy has been used to reduce the size of it. Last but not least, we have what we call watch and wait, or active monitoring. This is what happens when you're told that you have a cancer diagnosis, but at the moment that cancer is not sufficiently advanced to need treatment. We are aware that that's a bit of a worrying time for you because we've told you your diagnosis and then we're saying we're not going to do anything. However, what you need to bear in mind is that your cancer is low grade at this time and you will not get any benefit from treatment. If that's the case, we'll monitor you, possibly with scans and blood tests on a regular basis until such time as treatment becomes needed. You may also hear about targeted or hormone therapies. These are mostly used to treat prostate and breast cancers and are often administered either by injection or tablet format. With all of these treatments, there is the risk of side effects. Bear in mind that these days we can do an awful lot to help manage side effects, so the picture from days gone by of somebody looking absolutely awful on chemotherapy is less common these days. The side effects that you're probably most aware of are things like hair loss, weight loss, diarrhea, nausea, and fatigue. Nausea is something that we can do a lot to manage. You'll probably routinely be prescribed some antiemetics. So these are anti-sickness tablets which you take alongside your treatments, and these can be very effective. If you find the one you're given isn't working, please do contact your CNS because there are others that we can try. Hair loss is another possible side effect. It's not as common as it used to be, but it can still affect some people. If you do suffer from this, you can choose whether you want to go the route of having a wig or a bandana, or if you just want to tough it out. But whatever you do, we have various different ways of supporting you through that, including a national charity which provides goodie bags. Fatigue is something that we will come on to in more detail later on. We just want to make you aware of it. Not everybody succumbs to it, but it's important to be able to identify the symptoms of it and to know what to do if you do fall victim to it. Whilst you're going through your treatment, we will need you to have regular blood tests. To make this a bit easier, we have a phlebotomy clinic that's held in the Robert White unit. You do need to pre-book appointments for this, and you can either phone in directly to the Robert White reception to do this, or if you talk to one of us, we can make those appointments for you. We'd like to give you a few tips on how to make the most of your appointments. We're aware that these can be quite daunting affairs, so there are a few pointers that we're going to run through. First and foremost, make a list of all your questions before you come to the hospital for your appointment. Don't be afraid of getting your list out and running through your questions whilst you're in with your consultant. Take time to make a note of your answers. You're going to be given so much information that you're probably not going to remember it. So there's no point in having your list if you haven't also noted the answers. The other thing that helps here is to have a second pair of ears. We normally recommend that you bring somebody with you. If you can't bring somebody with you in person, there are other options. You can ask them to phone in and put them on speakerphone whilst you're having your appointment. Do ask your consultant beforehand, but they probably won't object to this at all. The other option is FaceTime. This is something that we've been using increasingly over the COVID period, and it's worked out quite well, so it really is something that you could consider. It's really important not to be intimidated by the language that your doctors and consultants use. They're not doing this to be clever. It's language they use every day, but for people like you and me who aren't medical, it's something which can be quite alien to us. It's your treatment. If you don't understand something they're saying, do stop and ask them to explain it so that you do understand. Whilst you're having chemo or radiotherapy here at the hospital, you will be given a parking permit which entitles you to park for free at any of the spaces in the hospital. If you're having treatment at other hospitals, please be sure to ask what entitlements you have as far as reduced fees go for parking. You may well be entitled to a blue badge, which makes parking a lot easier in hospital and outside of hospital. You can apply for this yourself, or it may be that we can help you do this on a fast-track basis. If getting to and from your appointments is an issue, you may be eligible for patient transport. Do ask for details if this applies to you. If you're lucky enough to be able to travel once all of this is over, please bear in mind that you do need to ensure you have adequate travel insurance in place. Not going to dwell on this at the moment because it's not relevant for most of us, but please bear it in mind for future use. If you're not already exempt from prescription charges on grounds of age, your cancer diagnosis does provide you with an exemption certificate. This applies to all medications, not only those to do with your cancer diagnosis. Your nurse will fill out a prescription exemption certificate. We stamp it and you need to send it away to get your card. This is valid for 5 years and can be renewed as many times as is necessary. Making choices about work, it is important to realise that with a cancer diagnosis, you do have a degree of legal protection as far as your employment goes. Your employer has a legal obligation to make what is termed as reasonable adjustments. This might mean reduced hours, flexi time, or working from home. We have got a Macmillan booklet that gives you far more detail on this, but if you need advice or are having problems with this, please do contact us or the Macmillan Citizens Advice Bureau. Something that we urge everybody to do sooner rather than later is to make contact with the Dorset Macmillan Citizens Advice Bureau. The team at the Dorchester Citizens Advice Bureau have been specially trained and they know all the ins and outs of what you're entitled to with a cancer diagnosis. In the past, we've had many people who say, well, I've never claimed benefits in my life and I'm not going to start now. Our advice would be, these are not benefits, these are entitlements. You're going through a very difficult time and this is something you're entitled to, which may make things a little bit easier. You can contact the team at the CAB either by phone or email. They will get back in touch with you if you leave a message on their answer machine. Obviously, they'll need to go through your finances with you, but by doing that, they can see if you're eligible for any other entitlements, and they can also help you with things like cashing in health insurance policies or settling mortgages or other loan repayments. The Macmillan team may also tell you that you're entitled to put in a claim for a Macmillan grant. This is something which is done on a means-tested basis. And if you're eligible, you may receive a sum of up to £500, which can be paid once in a 12-month period and can be used for things which will make your life easier at this difficult time. For example, a new washing machine if yours has just died, or a new bed, or a chair that's easier for you to get in and out of whilst you're going through treatment. Please do ask for details. If you feel you may not be eligible for the Macmillan grant, as you feel your income or your savings are too high, there's another association we'd like to make you aware of. They're called the Dorset Cancer Care Foundation, and they can provide grants and all sorts of other assistance. The grants are not means tested, so do get in touch with them and we can give you the details for that.
I would like to talk to you about the support groups. We are very lucky here in Dorset that we have some fantastic cancer support groups. Meetings have previously been held in weekly face-to-face sessions, but since the coronavirus pandemic, they have had to find new ways to ensure they can continue to provide valuable support to their members. The Living Tree are based in Bridport, and they would normally meet at the Quaker Room on a Friday afternoon from 2 p.m. They are currently offering support, therapy sessions, creative activities and friendship through the web-based platform Zoom. For members who are not online, they can offer support over the telephone. They also have a fortnightly newsletter and a very informative Facebook page with information on local services. Butterflies Cancer Support Group are based in Dorchester, and they would normally be based at the New Church in Poundbury on a Wednesday afternoon from 2 p.m. They offer free therapies, guest speakers, activities and support. They are continuing to provide support to their members through a buddy list, and they produce a regular newsletter. Seasiders are based in Weymouth and Portland, and they would normally meet at the Wyke Smugglers on the first and third Mondays of the month from 7:30 p.m. Although all regular meetings are currently cancelled, they are hoping to set up a Zoom meeting once a month. Their details can be found on their Facebook page. The Purbeck Workshop are based in Wool, and they offer free creative activities and events throughout the year, such as painting, arts and crafts and floristry. Unfortunately, all meetings are currently suspended until further notice, but they do have a good Facebook page, and they are looking at setting up online workshops in the near future. The Axminster and Lyme Support Group are currently holding weekly online Zoom meetings every Monday, where members can share stories, swap ideas and offer support. They also have regular guest speakers and therapies, as well as counselling. They are keen to offer support to anyone who has had a cancer diagnosis in Dorset, and new members are welcomed. They even have a beach hut which can be booked by their members and used throughout the year. If you live further afield in North Dorset, there is a support group called SCARS, and they are based in Stallbridge. The Forum Otters are based in Blandford and would usually meet at the Woodhouse Garden Pavilion on the second Thursday of each month between 2 p.m. and 4 p.m. The Dorset Carers Hub are based in Trinity Street in Dorchester, and they provide a safe and comfortable space for carers to be provided with the information, support and advice they need. They have a very good website page, and they welcome new members. We also have some cancer-specific groups here in Dorset.
Up to now, we've focused primarily on the medical side of your treatment, but we would like to talk a little bit about the emotional side as well. This is extremely important, and we want to give you some little tips to help you through the difficult times ahead. Funnily enough, the NHS along with Macmillan have come to the conclusion that if we treat you as a whole person, which involves not just the medical side, but looking at the physical side and the emotional side as well, we're going to get a lot better response from you as you go through treatment. To this end, we may well ask you to fill out something that we call a holistic needs assessment. It's an A4 page, and it has a lot of tick boxes on it. And the reasoning behind this is that it gives us a little bit of an insight as to the other areas of your life where you might need a little bit of help and guidance. The way it works is that we ask you to give things a rating, so 0 or 1 if it's very low, through to 10 if it's scoring very highly and is something you're in quite desperate need of help with. Normally we ask you to do an HNA at the beginning of your treatment and at the end, but you can do one at any point. You also don't have to wait to have a paper form to fill in. We're here on the phone, and if at any time you want help or advice, please do call. How are you feeling at the moment? Chances are that you're experiencing a huge range of emotions right now. There really is no right or wrong way about this, and it's perfectly natural to go from feeling okay one minute to the depths of despair the next minute. And by the way, this applies equally to your friends and family who are supporting you through this tough time. If you have a look at our diagram, you can see that there is just emotions all over the place, and you may well find that you pass through all of those in 5 minutes, or possibly over a 24-hour period. It really is an emotional roller coaster. That's great if you like roller coasters, but most of us would not choose to be on this ride. You may even find you experience what I call tumbleweed moments. So you're fine 1 minute, but the next minute your mind has taken you to a worst case scenario 6 months down the line. What can be helpful under these circumstances is to practice something called mindfulness. We have got some exercises that we can share with you on this, but it's much easier to do those on a one-to-one basis, so we can talk you through those individually if you do want more details. Overall though, we'd say the key to all of this is to keep breathing. And I know that sounds really basic, but if you think of the times when you are all in a flurry and someone says to you, stop, take a deep breath and start again. The same applies in these circumstances. When you feel your anxiety and your stress levels mounting, it really does help if you can stop and focus yourself back on the here and now. And that's one of the things that mindfulness helps you to do. When you're going through all of this, it's really helpful sometimes to take a step back and say, if this was happening to one of my close friends, what would I do and what would I say? It's perfectly natural to feel a little down and depressed and have a low mood. However, if this low mood lasts longer for 2 weeks and that you feel it's getting worse rather than showing any signs of improvement, that's the time when you need to start to think about getting some help. We would recommend finding someone to talk to. Start by talking to your friends and family. Some people find that that's not very helpful. They find they're too close and that they're already burdening their friends and family with everything else. So it might help to go a little bit further afield. You can talk to us. We do have a counsellor here as part of the cancer team, and you are entitled to up to 6 face-to-face sessions for you or your partner. Obviously these would be Zoom sessions at the moment. And there are other resources available as well. There's Steps to Wellbeing, and that's a self-referral service. There's Mind Dorset, Help and Care, and last but by no means least, the Macmillan Advice Line.
The Macmillan Therapy Team is based here at Dorset County Hospital, and we are predominantly based on the Fortuneswell ward. The team consists of an occupational therapist, a physiotherapist, a speech and language therapist, a support worker and a therapy assistant. We see inpatients mainly, but we also do see people as outpatients to help them manage fatigue and breathlessness. You can be referred by your clinical nurse specialist or chemo nurses here at Dorset County Hospital. Next, we're going to talk about fatigue, as fatigue is one of the most common side effects that is reported by our cancer patients. Fatigue is so much more than just feeling tired. You may feel that a good night's sleep is going to help, but actually the more that we sleep, sometimes the worse that makes you feel. You need to keep as active as possible and find a good balance between activity and rest. It's important that you recognise the symptoms of fatigue.
My name is Denton Wilson. I'm 56 years old. I live in Sheffield. I was diagnosed with prostate cancer when I was 42. I opted to get an operation for that. I had a choice of either chemo or the operation. I chose the operation. After the operation, I think that's when things started to happen in my life, which I never knew I was going to experience. Things that I used to do I was no longer doing. I've always been house proud. I've always been sexually active. I've always been outgoing. I just like to have fun, and basically all that was just cut short straight away. I felt isolated. I could not go anywhere. I couldn't be bothered to clean up. I couldn't be bothered to do anything, basically. I just felt kind of useless. It was mental and physical. I couldn't understand the effects because I've never experienced these effects before. I've never experienced these feelings before, and they were real. They were real to me because it was happening to me. And I felt so kind of low that I didn't know what to do. I was confused. My concentration level, it was kind of upside down. You know, just to actually getting out of bed was hard. Going downstairs was hard. Simply washing my hands or turning the tap was hard. If you dwell too much on fatigueness, it can ruin you. And you need to actually set goals. So I basically set myself goals, like I said, to start off coming out of bed, going into the toilet, and then eventually starting doing different things in the house, just bits at a time. And your fatigue level then starts to disappear a bit because you're actually doing something where they're not doing nothing. Having my grandchildren was a great help for me. It was another step in getting me more better in understanding certain things in myself. And having them in my life actually gave me that impetus to do even more. And they've been in my life ever since. I didn't know nothing about Macmillan, but if I did, they would be the first person I would have actually talked to. I wouldn't have had to go through the mental and physical torture that I had to go through. At the time, I thought I would never get better. I could not see the lighter end of the tunnel, you know what I mean? But I've overcome that, you know. I'm a living proof of that. I've moved forward my life. And if, like I say, if I can do it, anyone can. It's all about having that positive outlook, and it can work because it's worked for me. It can work for anyone.
For information, help, or if you just want to chat, call the Macmillan support line on 0808 808 0000 or visit macmillan.org.uk.
So moving on from fatigue, we next think about energy conservation. So when you're looking at this slide and you visualise your energy as part of being a rechargeable battery. So if you think about your mobile phone, you always keep that charged so it doesn't go into the red. We are thinking about the same for you and your body. So again, when we're considering conserving our energy, we need to think about the 3 Ps. So in that, we look at planning your day. So when do you have the most energy during the day, whether that be the morning or the afternoon? That is when you would plan to do some of the activities. Also, we would look at prioritising what is important to me today. What is it I would like to do as much as what do I need to do today? And also what we need to consider is pacing ourselves, listening to our body, and we need to rest before we feel really tired. When we think about this next slide choice, we also consider with the energy conservation about how we are going to manage our day and who we may ask for help and maybe delegate some of those tasks that are difficult at the moment. We don't need to race up the stairs right to the top in one go. Taking one step at a time is much easier, and that coincides with the 3 Ps. We also think about the choice of who we tell and how we tell those people, if that's what we think we need to do.
We'll hear from a Manchester councillor.
No way, so bad.
A little exercise is good for all of us, particularly if you've had cancer. It will reduce the side effects of treatment and can even help prevent some cancers returning. But you don't need to run a marathon.
You got fig rolls?
Oh, Joe.
Hurry up, 'cause I'm starving.
Just a short jog or brisk walk to the corner shop can help.
As you saw from that video, rest really is not best. You may have a cancer diagnosis, but that doesn't mean that you now have an excuse for not exercising. The days when we would say, oh, you're poorly, rest up, those have gone. What we will be doing throughout your treatment is encouraging you to remain as active as possible. This doesn't mean that we want you to embark upon an Olympic training regime. No, far from it. What we want you to do is maintain your current level of fitness and, if possible, build on that slowly and steadily. The fitter you are at the start of your treatment, the better you'll respond to treatment, the fewer side effects you're likely to suffer, and the quicker you will bounce back. So when we talk about exercise, what exactly do we mean? Where to start with your exercise programme? We would recommend trying to do 2.5 hours of moderate intensity activity per week. This could be just in small bursts throughout the day. It can be things as simple as sit to stand when you're sitting at your dining room table or in your living room watching TV. Short walks, a walk around the block. So if you already do that, keep doing it. Maybe extend your walk and go a little bit further, or you could try doing it a little bit faster each time. There are various exercises you can do whilst you're watching TV. These include picking up a couple of cans of something like baked beans so that you can do some arm exercises whilst you're sitting comfortably in your chair, and you can do that whilst the commercials are on. The other thing that's quite good for getting up your steps is walking up and down the stairs throughout the day. A little tip there is, rather than saving everything up that needs to go upstairs and doing one trip at the end of the day, every time you have something that needs to go upstairs, take it upstairs and come back down again. When you have something else, do another trip. So at the end of the day, you'll have racked up a good number of steps, 10 times more than if you just did that one trip. A very simple but effective tool that you can use at home is one of these. This is an exercise band or a resistance band, and there are a multitude of exercises you can do with this. We do have a sheet that we can give you, but the main thing is just to build it up slowly and make sure that you're not doing anything that's contraindicated with your cancer diagnosis. Another reason exercise is important is that when you become inactive, muscle fatigue, muscle wastage and joint stiffness set in really quickly. So we'd encourage you to do whatever you can just to keep moving. Remember, rest is not best. We're very lucky to have a number of specially trained fitness instructors. Some of these are affiliated to the support groups that we mentioned earlier. We have CFIT, who are affiliated to the Seasiders, the Weymouth and Portland support group. We have Stepping Out, who are affiliated to the Living Tree in Bridport. And we have Luke Hayter Fitness, and he's a very enthusiastic young man who does specially designed cancer rehab sessions. In addition to this, if a gym is not your thing, there are many Walking for Health groups that meet locally, and these can be found by looking online. The emphasis really isn't on hard activity. It's more important just to keep active, get out there and keep moving. Okay, so we've talked about energy out. The other important thing is energy in. What you eat during your cancer treatment is really important, because that is going to provide your body with fuel to see you through your treatment. A lot of this is common sense, and it's probably stuff that you'll be aware of already, but I'd like to talk you through what's known as the Eat Well Guide. You may well have seen this graphic before. It's known as the Eat Well Guide, and the idea is that that represents a plate, and you should be looking to fill your plate 1/3 full of each of the different food groups on there. So in green, we've got fruit and veg. The yellow section, we've got carbohydrates, so it's things like potatoes, bread and pasta. And the blue and pink is proteins, so that might be meat, pulses and protein sources such as dairy products including cheese. We've also got a section which shows the forbidden foods. Let's talk about these as treats. They're not forbidden, but they're not really healthy. We know they're not, but it doesn't mean you can't ever have them. So crisps, chocolate and sweets and cakes belong in that section. The other thing that's really important to mention here is hydration. We recommend that you drink a minimum of 2 litres of fluid a day. This is mainly water. If you're used to drinking tea and coffee, that counts towards your 2 litres. However, alcohol unfortunately doesn't. The reason that we stress the importance of taking on enough liquid is that it helps to flush your chemo through your system. We don't want that accumulating more than is necessary. And the other reason is to guard against constipation. You will find that we ask you on a regular basis how your bowels are, and that is important. If your bowels become sluggish or if you suffer from constipation, we need to know about it so that we can rectify it sooner rather than later. If you do use ready-made meals, be aware that most of them these days are labelled with what's called the traffic light system. It's pretty much self-explanatory, so if something has a red label on it, you should be looking to avoid that as far as possible. Amber means it's not so bad, and green obviously is the best rating. You'll find a combination of these for fats, sugars and carbohydrates, plus the calorie content will be shown as well. So it's just a way of keeping a check on what you're eating. When should you seek help? You should do this if you're eating less than you normally would, if you have a reduced appetite, if you're having nausea, diarrhea and/or vomiting, especially if you've lost weight without trying, if you're having swallowing problems, and if you're restricting foods in your diet for other reasons. If any of these apply, or if you need some specialist advice, please speak to your doctor, your specialist nurse, or us, and we can refer you to the dietitian. It could be that you're on a special diet, and if that's the case, your team will be aware of this. And if you need any more specialist advice or help, please speak to your doctor, your nurse, or the dietitian. Be aware that now is not the time to start any faddy diets. You may have read online that eating only one particular food type will cure your cancer. Sadly, that won't be the case. So do be careful if you're looking online for diet ideas. We've got a list here of reputable sources, so if you do want some ideas, please take a look at these. One final organisation we want to make you aware of is Live Well Dorset. This organisation provides help on weight loss, exercise, and of particular importance whilst you're undergoing cancer treatment, smoking cessation and alcohol reduction or cessation. We wouldn't advise you to embark on any weight loss at the moment unless you've been specifically advised to do so. And as far as exercise goes, this organisation is useful because you can put in your postcode on their website and it will direct you to exercise activities in your area. The 2 big things that you can do to make a change whilst you're having cancer treatment is to stop smoking and to reduce or stop your alcohol intake. Those are the 2 main things. We cannot stress that enough. If these apply to you and you want some help, please turn to Live Well Dorset. They provide a coaching service which has obtained brilliant results over the last couple of years, and you can refer yourself either by telephone or online. We're aware that we've given you a great deal of information and you're probably going to need a little bit of time to digest it all.
If you would like any further information on any of the topics we've covered, please don't hesitate to get in touch with us. We have a huge selection of information and booklets that we can send out to you.
Please don't hesitate to contact us if you have any questions. If we don't know the answer, we will know somebody that does.
We appreciate you taking the time to watch this video. Thank you.